CVDEvaluator is a guideline-aligned clinical decision support platform built specifically for cardiovascular and chronic disease management, where evidence-based care meets effortless documentation. Clinically tested and peer-reviewed, CVDEvaluator is published in the Journal of Cardiac Failure and the Journal of Clinical Lipidology, clinical validation that sets CVDEvaluator apart. Getting started is seamless. Simply accept the terms of use, create your secure password, and you're in. Every encounter begins on the demographics page. Enter the patient's initials, date of birth, and gender, and CVDEvaluator's structured workflow takes over. Data entry is fast and flexible. Built-in voice dictation follows 3 steps: start, stop, send to AI. Each session generates 2 synchronized outputs: a polished AI-generated clinical summary and the complete verbatim transcript. Full transparency, full control. Built on foundational frameworks including the ACC Dyspnea Grading Scale, NYHA Functional Classification, and PQRST Chest Pain Method, the symptoms and medical profile pages anchor the system's core clinical logic. Not just checkboxes, but the structural backbone of accurate cardiovascular documentation and rigorous guideline implementation. Physical exam, laboratories, and diagnostics all follow standard clinical conventions, with context-aware highlights that guide you toward complete, thorough data entry. When ready, you may select Preview Submission. Every input, voice, manual, or both, transforms into a fluent, ready-to-submit clinical narrative, comprehensive enough to support prior authorization and medical necessity documentation. No reformatting, no copy-pasting. Clinical decision support runs on 2 parallel pathways. The CVDEvaluator logic engine, built on peer-reviewed, guideline-based modules, simultaneously serves as the structured foundation for AI prompting. The OpenAI Evaluate pathway delivers additional LLM reasoning within the same clinical framework, dynamically powered by a curated selection of frontier models. CVDEvaluator is secure, cloud-based, and synchronized across web and mobile. The platform also automates ICD-10 coding and risk adjustment scoring, helping health systems reduce denials, improve reimbursement, and manage the rising cost of chronic disease care. CVDEvaluator supports, but does not replace, clinical judgment. It does not autonomously diagnose, treat, or recommend specific therapies, and complies with FDA guidance under the 21st Century Cures Act.